Singapore will soon roll out advice on how people can avoid heat injury. The Sustainability and Environment Ministry will make this available in the coming weeks as temperatures are expected to rise in the next few months. Chloe Chu with more.
It's getting hot in here and will only get hotter. At a dialogue on climate change and world resources, the Sustainability and the Environment Minister says people will get help adapting to these rising temperatures.
We can expect more cases of personal injury and loss of lives due to heat injuries. To help Singaporeans better protect themselves and their loved ones, my ministry will implement a heat stress advisory framework in the near future to guide us on how to plan our activities, what actions to take to protect ourselves, and what attire to wear for outdoor activities for the forecasted weather conditions.
One doctor has already seen a 10% increase in patients presenting heat stress symptoms over the last 2 months.
We do see a certain group of patients, more so construction workers, food vendors, and military personnel who are typically present to us with headaches, fatigue, body aches, muscle pains, especially after prolonged hours of work.
And heat exhaustion can affect everyone, not just those who work outdoors.
It can also affect indoor environment, especially with an inadequate ventilation. This can result in work productivity, as in a reduction of work productivity, and lifestyle changes as well. So, for example, I'm sure most people are more hesitant to do physical activities, outdoor physical activities, especially during this period of time. This can indirectly affect our physical health and mental health as well.
Since April, Asia has experienced heat waves and record-breaking temperatures. Singapore has already hit 37 degrees Celsius in May, the highest in 40 years. And it may get worse as it sees lower rainfall and drier days in the traditional monsoon months, with the El Niño weather event expected to return this year. Meteorologists also expect global temperatures to hit record high in the next 5 years, which could call for more lifestyle changes.
And for more on this topic, we're joined by Dr Ong Pei Yuin, a consultant in the Department of Emergency Medicine at the National University Hospital. Doctor, we just heard the list of heat stress symptoms. Are heat stress injuries also the same as heat stress symptoms? And if not, how serious is a heat stress injury?
Hello, good evening. Heat stress injuries are another name for heat injuries, and they are actually a continuum of injuries that's induced by high temperatures exposure. So there is quite a significant range, and the range goes from heat syncope, for example, when somebody faints due to the heat, but no other bodily harm, they come to no other bodily harm. And the next most serious one would be heat exhaustion, where they would actually have some symptoms of unusual fatigue, muscle cramps, irritability, excessive sweating. Sometimes they feel giddy, agitated, and unusually tired. And now, if this is not addressed, it then progresses on to heat stroke. And heat stroke is very serious. The core temperature of the body is very high, greater than 40.5 degrees. There are significant confusion, lethargy, and possibly even coma states. And sometimes the patient can even go into seizures. The heart rate will be very high. And paradoxically, from excessive sweating, sometimes the skin becomes very hot and dry because the body has lost the ability to regulate the heat. And when patients reach this state of heat stroke, actually it's very risky, and there is a risk of mortality. So the overall name for heat injuries is actually for the entire range of injuries. And the most severe of them all is heat stroke. And this is something that we have to be very aware of in hot and humid Singapore. And we have to really be careful to prevent such cases from happening.
Dr. Ong, heat stress can also happen if a person is indoors, but presumably the chances of it occurring when you're outdoors may well be higher. What are the implications of that for those who have to perform activities outside, for schools, for children, for workers as well?
Definitely. Prolonged exposure to heat in whatever forms, but usually this is more commonly outdoors. Well, there would be ways to manage it because we do live in a warm country after all. And for schools and people doing outdoor workouts or outdoor activities, they could choose to time their outdoor activities in the early morning or in the evening. And they should avoid being outdoors during the hottest time of the day. For example, say from 11 something till 2 or 3 p.m., especially if it's a particularly hot day, they may, if possible, try to avoid being outdoors. Now, if they have to be outdoors, they could hydrate with fluids and isotonic drinks before and after as well. And they should drink approximately one or more bottles of fluids for every hour that they are outdoors. If they need to be outdoors, well, they should try to stay in the shade or sheltered areas as much as possible. And the temperature difference between a sheltered area and an area in direct sunlight is actually quite significant. And aside from that, everyone can take measures to wear appropriate clothing that's lightweight, breathable, and clothing that's able to remove sweat and dry quickly. And that helps to keep one's temperature cool. Besides that, everyone should also be aware to stop if they don't feel well, they feel excessively tired, giddy, or have unusual muscle aches. So these are some measures that we can all take to protect ourselves from heat injuries.
Dr. Ong, what you mentioned is for those of us who have essentially grown up in this kind of climate, it's fairly common sense with the things we have to do every day to avoid the worst of, say, midday sun. But this guidance, I take it, will add even more detail to this fairly common sense general structure in terms of how to avoid heat stroke if you live in Singapore. What kinds of guidance do you think would be in this new advisory framework that would add further detail to what you've already just told us?
I think there should be at least two components to it. Maybe an area to teach people how to prevent, and that would include all the areas that I talked about just now, like how to protect themselves, clothing, and so on. Extra care should be placed on vulnerable groups, which would be young children, elderly, and also the sick and those who are unable to express themselves, unable to move themselves to a cooler situation. There should also be education for the public to learn how to recognize what are the symptoms of heat injury and also how to treat minor heat injuries and when to know how to bring someone to medical attention. Would there be a need for a warning system? Possibly, if Singapore were to face more and more days of heat waves, especially if the temperature goes higher and higher, and it's very, very humid as well, it's very difficult for our sweat to evaporate, then we could consider some sort of alert to tell people that avoid being outdoors during midday if the temperature is unusually high.
Well, thanks so much for joining us this evening. That was Dr. Ong Pei Yuin, consultant in the Department of Emergency Medicine at the National University Hospital.